This is the Committee on Unleashed Prosperity Economic Forum. Thank you so much for coming. Our summit on how to rebuild our economy from the policies of the last 2 years have been so disastrous, and it's been about 2.5 to 3 years since COVID hit the shores of the United States. And it is my contention, I think we have some of the world's experts on this, that we did a lot of wrong things in the United States, and my worry is that the next time we either have some kind of variant of COVID or some new virus, that the left and the Democrats and the health, quote, experts will try to lock down our economy again. I happen to think that one of the greatest tragedies and mistakes in our country's history was what happened in 2020 with the lockdown of our businesses and our schools and our churches and our restaurants. And so we have assembled, an amazing group of health experts and economists to really walk us through what we did wrong and how do we make sure we don't do this again. And so Phil Kerpen really, who works as the president of the Committee to Unleash Prosperity and really became one of the world's experts on COVID, maybe the only people who know more about COVID than Phil is the other three of you on this panel. But Phil was a regular on Fox News with Laura Ingraham almost once a week throughout COVID, really explaining to Americans what was really going on. Phil, you called it right from the start. And one of the things I'm kind of proud of at the Committee to Unleash Prosperity, we were really truly one of the first groups in Washington that called the shutdowns a mistake. We were probably one of the lead groups against lockdowns, and I think we were proven right about that. So
and school closures.
And school closures as well. So, Phil, why don't you moderate this panel? You can introduce folks, and please make this a discussion, because I think people have a lot of questions about what happened and what we did wrong.
Yeah, absolutely. Thank you, Steve. And it's been an interesting last couple of years for me, because Steve asked me to help out with Committee to Unleash Prosperity, I think, in February of 2020, and I thought I'd be doing economics, and then instead it was all health stats and COVID and hospital utilization and all this kind of stuff. And then we decided we'd do a little newsletter for the duration of COVID, which we thought would be a couple of weeks, and now we're 3 years into doing it every weekday, and no end in sight. And of course, we've brought in to cover a bunch of other issues as well. So if anyone's not getting the newsletter, sign up at the Committee to Unleash Prosperity website. We've got the real world's experts, a tremendous panel here for you today to go through all of these issues. And I guess we'll start at the end and then move back towards me, and then we'll go into discussion after people's opening remarks. So let's start with the man who did probably the definitive study in terms of international comparisons on the efficacy of lockdowns, which were approximately zero. Steve Hanke from Johns Hopkins.
Okay, thanks, Phil. We did a large study, a meta-study, of the effects of lockdowns, and the conclusion, which many people thought was quite controversial, was that you had basically a tiny effect of lockdowns associated with lockdowns. In Europe, you saved roughly about 13,000 lives, and the average flu season, 76,000 people die in Europe, to put the thing in context. So the lockdowns, in terms of their effects on mortality, we measured it against mortality, were basically irrelevant. You lock down the economy. We know the health benefits measured vis-a-vis mortality were essentially zero. So it doesn't take a genius to figure out a benefit-cost analysis and figure out the cost, the GDP you're losing, the schooling problems, and everything else associated with that we know bits and pieces about, and we've got people up here who know much more about it than I do. Those costs are massive, and the health benefits are essentially zero. So that's the benefit-cost test. I mean, you don't even consider lockdowns. Now, by the way, one important point. There's only one country that really avoided the lockdowns with the plague, and that was Sweden. And remember how the press was hammering the hell out of Sweden because they weren't locking down. It turns out Joning and I looked into this, in some detail, and we published an article actually in the Wall Street Journal about it. And if you look at the Swedish Constitution, which was written in the 16th century, they actually, it would have been illegal to lock down, because the Constitution states that a Swede is free to move within Sweden and free to exit Sweden, and the government can't touch them. So lockdowns would have been actually illegal in Sweden, and that's why they did not have them. And if you look at the results, after their initial hammering in the press, what happened? They look pretty good. So Phil, did I salvage myself?
Yeah, I think so. I think so. And thank you very much. Let's go next down the line to Dr. Casey Mulligan from the University of Chicago, who is also a senior fellow with Committee to Unleash Prosperity and one of the most productive academics that we've ever seen. Just incredible how quickly he turns around papers, and he's done a lot of analysis. And I think maybe most significant, he's found very large non-COVID excess deaths that continue to go on for a variety of reasons. So let's hear from Dr. Mulligan.
Yeah, I think I want to speak from an economic point of view, why we knew in March 2020 that Steve would find what he would find 2 years later, that lockdowns wouldn't work, without being a medical expert. So let me give you a little story. It's a tragic story, but bear with me. Go back about 60 years or so in China. And in China, they decided they wanted to have more domestically produced steel. So what Mao told them to do was told the peasants to make steel in their backyard. Now, you don't need to be a metallurgy expert to realize that's not going to work. The peasant household is too small a scale to make steel, okay? The household, the U.S. household of 2020 is too small a scale to be fighting the spread of a disease. Why did I know that from an economic point of view? Because almost everything we do well, we leave the household to do it. We leave the household to go to school. We leave the household to go to the doctor. We leave the household to go to work, to make the widgets, to whatever we do. That's when we get together in teams, we cooperate. And we already had these teams assembled. It's not like we had to assemble new teams to fight COVID. We already had these teams assembled in schools and workplaces and civil society generally. Those should have been allowed to show what they can do. But instead, our policy was exactly the opposite. The regulator said, thou shalt not go to those places where you do wonderful things with your partners, your classmates, your coworkers. And if you're thinking about doing it, we will pay you money to stay at home away from those people that you do such great things with. So that was completely backwards. And if you look at the data on the schooling, on workplaces, when they were finally allowed to get together, they were actually very effective at slowing the spread. Not to mention to continue their ordinary mission, like learning and making the widgets. So that was a tragic and knowable mistake. And some of the things that we do are actually health related. So this is another tragic element of it, that actually a lot of people died because they were supposed to stay at home. Some of them at home drinking. Alcohol is very cheap at home, by the way. Doing a lot of drinking, dying from liver disease. A lot of people dying from homicide, drug, opioids, especially fentanyl, traffic accidents, diabetes, heart conditions. I think a big part of what happened is, people, again, we work in teams. We work with our doctor. We work with our pharmacist. People normally, they go to the doctor. They have their checkup. 98% of the time, it's all normal. But 2% of the people need their meds changed. And it's really simple. You go to the pharmacist, you get it. But this wasn't happening. And those 2% of the people dropped dead. So we've estimated that on an annual basis, and I think it's still ongoing as we speak, 100,000 people, mostly younger people, have been dying in the United States from non-COVID causes above normal for those various causes that I mentioned. And again, that we made success. So that's just in the health realm. And I think the health is indicative of human capital across the board, the learning. Of course, the students don't know their math and arithmetic that they should have been learning. Younger people, Washington's full of younger people, right, who are learning things, learning from their mentors. Now their mentors are all hidden behind a Zoom screen. And so we're going to have a serious productivity problem going forward because of our complete neglect for human capital and really civil society generally.
Thanks. Let's get our opening remarks from our last panelist. You almost certainly know who he is. He was the only person fighting for sanity in the COVID task force of the last administration, which is a little bit sad since it was a Republican administration. From Stanford, Dr. Scott Atlas.
Okay, thank you for inviting me. So much to say. By the way, I was only on the task force from August through November of 2020 after 6 to 7 months of serious damage was done, unconscionable damage by grossly incompetent people who were politicized. And we can never forget that. So I'm going to talk about two things a little bit. One is off of that, which is what is the legacy? I've been asked many times, what is the legacy of Dr. Fauci? I want to make this very clear. The legacy of Dr. Fauci, as he announces his retirement or whatever he will do, is he presided over the biggest debacle in public health management in modern history. Okay? That's point number one. His legacy is a massive destruction of our children, and in fact, of the world's children. This was alluded to already. The United States broke the social contract we have with our children, our most precious resource, because we shut down schools due to the advice of Birx and Fauci and the other members of the media and the expert class. And we were unique in the Western civilized world. We're one of the only countries that shut down schools in fall of 2020, despite the facts known after the spring school closures. This was not learned. We knew then there were hundreds of thousands of child abuse cases not detected because of school closures, and schools are the #1 agency. Massive economic and therefore health harms on families with children. Kids were not getting to their doctors. There was an explosion of suicide attempts in teenage girls since the pre-lockdown year. There was an explosion of drug abuse in teenagers. There was an explosion of suicidal attempts and ideation of suicide in college-age kids. There's a massive weight gain, obesity, 28 pounds on average in 52% of college-age kids in the United States, and the learning losses that are quantifiably shocking that were known in the spring 2020 school closures. Okay, this was, by the way, all things are worse in the poor and lower income families. For a society that pretends to care about lower income families, we shut down and shifted the burden of disease from the affluent class to the lower class. That's what the United States of America did. The other legacy, besides the skyrocketing, and we've only seen the tip of the iceberg of damage to children, by the way. Can you imagine we've created a generation of young children, toddlers, who think that they are a danger to everyone and everyone's a danger to them. They are a disease vector. In Palo Alto, where I live, we see babies in strollers wearing masks outside and reminding their parents to put masks on. The other legacy of Dr. Fauci and Dr. Collins is a massive failure of the NIH. Why is there a massive failure of the NIH? They never did the obvious clinical trials of spring of 2020 on drugs that were already FDA approved. There should never be a debate 6 months, a year, 2 years later on if drugs that were already FDA approved work, like hydroxychloroquine, like ivermectin. These drugs were safe, given to billions of people throughout the world already, FDA approved. They had mechanisms of action, which is a medical science term for it should work. In the lab, it works, prevents viruses from entering cells, for instance. These are sort of obvious clinical trials to be done. They were never done. That's the responsibility of the NIH and the FDA. That's a massive failure. The other and most important damage of Dr. Fauci, this is before I get into the news yesterday or the day before, is the massive and lasting damage to trust now in institutions. Okay, there's a massive loss of trust by the public in public health guidance. In science itself, science has become politicized. We have a loss of trust in university experts. The universities are important because, A, they supply the experts to the government. When people look for experts, they often look at university professors. The media uses university professors for their credible sources. The public looks at and gives respect automatically to people who have these fancy titles. But even worse and more tragic is they're teaching our children, okay? The university professors, like all of us who have children who have raised our kids to respect authority, they get authority automatically by their titles. What have the university professors done? The university professors have become politicized overtly. They probably were all politicized beforehand. A lot of the stuff was existing but not revealed. But the university professors have now written in slanderous pieces, libelous pieces, verbal and written, into news media, into journals, stopping the free exchange of ideas. Universities' main purpose is the free exchange of ideas and therefore teaching critical thinking to young people. We have people who now don't understand critical thinking. I work at Stanford University still. I'm tenured. They also think that it's a very solid role model to try to destroy people who disagree with you. I mean, this is a sin. This is a tragic turn of events here that we have to face as a society. So that legacy of destroying trust in institutions that we need to determine truths is a lasting legacy of Dr. Fauci and the other medical experts who recommended lockdowns. And what do we mean by lockdowns? Because I was at a meeting in the White House in October of 2020 where finally it became obvious that the word lockdown was poisonous because I kept talking about the damages from the lockdowns. And Birx turned to me at the meeting and said, "Oh, Scott, nobody at the task force wants lockdowns." And I said, "Are you for business restrictions and closures?" "Yes." "Are you for school closures?" "Yes." "Are you for quarantining SARS-positive tested asymptomatic children?" "Yes." "Are you for stopping travel?" "Yes." "Are you for limiting crowd size?" "Yes." I said, "Then you're for lockdowns," as if that had to be explained. And so there's an Orwellian rewrite now going on in the media by Dr. Fauci, Dr. Birx, and others to say, oh, we never recommended school closures. Oh, we never recommended lockdowns. And in fact, they want to blame the people that criticize the lockdowns for the failure of the lockdowns that were implemented. The lockdowns were implemented all over the country, and the paper by Steve and his group that showed the lockdowns didn't work is really just one of many papers and the tip of the iceberg, and I want to clarify this. The lockdowns are wrong for two reasons. Number one, they failed to stop the deaths. They failed to stop the spread of the infection. But number two, they destroyed people. They literally killed people. When you shut down medical care, in spring of 2020 alone, there were 650,000 cancer chemotherapy patients in this country alone. Half of them didn't get their chemo because they were afraid. They were told it was dangerous to go to a medical facility. That's just spring. Okay, 85% of living organ transplants in the United States didn't get done. The organs were obviously still needed. 50% of stroke and heart attack patients didn't call an ambulance because they were told to be afraid of a medical facility. This was spring of 2020. And then the papers started coming in retrospect, proving what we knew. And when did we know it? We knew it in 2006. When the standard paper on pandemic management, the standard paper, said that lockdowns were horribly harmful and didn't work. And that paper is by Inglesby, Nuzzo, O'Toole, and Henderson, the person credited with ending smallpox. In 2006, the standard pandemic management said, no, lockdowns are destructive and do not work. And we did them anyway. So why did we do it? This is the big question that, the answer to why is always the most difficult. There were several things going on. Number one, fear makes people irrational. And there was always, and that's, I think that's a sort of a basic tenet of human behavior, but we never had a pandemic in a social media era. And I think that social media amplified the fear tremendously. Okay, this is all my opinion, by the way. I think that because we were in an election year, there was a tremendous amount of politicization of the pandemic. We're talking February, March here of 2020. Now, I have to say that from what I saw by the time I got there, yes, people were political, but when I came home or when I was talking to my wife right before the election in October, she said, oh, if Biden wins, it's going to be all over. They're going to open up. And I said, no, it's not political. It's not political in the sense of partisan. At that point in time, everyone was all in. There is a psychological obsession at this point. And I think that what we're seeing here is confluence of motivation, okay? I don't believe that there is a grand plan. First of all, you're giving these people too much credit. They're idiots. I mean, it's incredible, the level of incompetence. By the way, I'm sorry, but I speak pretty bluntly. The confluence of motivation, what I mean by that is, okay, there are people, there's pharmaceutical corruption, but it's not all money. There's people who are complete pathologic narcissists who want power over people. They want to be in the limelight. They want to get the standing ovation when they walk into the Washington, D.C. restaurant, which still goes on here for certain people, believe it or not. They want accolades. They want to have control. Okay, there are people who have various motivations. So it's very hard to say why it happened, but it steamrolled into two things that were the most shocking to me. Number one was the tremendous power of the government in the United States to automatically shut down everything with impunity, whether it was legal or not. The legality is not why Sweden didn't lock down and we did. We did illegal things here also. But the second shock is the acquiescence of the American people. When you look at the protests of the lockdowns, the protests were in the countries that we viewed as, very passive socialism, sort of accepting populations, France, the UK, Italy, Germany, Australia, all these places protested the lockdowns. There was almost nothing in the United States. That's shocking and very frightening to me. So I think that that's the legacy side is we have it's what the pandemic revealed. It's not the pandemic anywhere. We have to figure out how to fix the country from what this is exposed. I just want to mention before I stop, I'm sorry to go on, the virus approval.
I'm going to ask you about that in a second, but I just want to address Steve's question because I think the initial panic response from Western governments was had to be a perception that it might be a bioweapon because none of what they did was in any of the pandemic response literature. None of it was in any of the pandemic response plans. It was very different to what we've done in past pandemics. And we had a pandemic in 2009 that was similar in some respects to this. None of these things happened. I think that they couldn't exclude the possibility that this was a weapon. And so they freaked out. And you had a lot of national security people making the decisions rather than public health people. And what happened is after you had the initial lockdowns, and it wasn't the U.S. first, it was Italy first, and then Spain and several other European countries, but that you had a policy contagion because the perception was, if we're not as aggressive as these other places and things go badly, we'll be blamed as politicians. If we do the most over-the-top things possible, then whatever happens, it won't be our fault. And then that was fed and amplified in a positive feedback cycle by the media because if you were not imposing these measures, then you were responsible for any of the COVID deaths. But if you were, then you were doing everything you could and you were a hero. And you look at the differential coverage of Cuomo and DeSantis, for instance. So it all sort of fed on that. But I think the initial miscalculation, my guess, was that there was some fear that this was a bioweapon.
But even if it was, the lockdowns don't work.
Correct.
Okay, it's a respiratory virus.
The nature of a panic response is
right,
it's not rational.
But I'm saying, I think there's another part of the answer that people don't talk about too much about why these things were done. You have to look historically. Birx, Fauci, and Redfield all worked together on HIV. Okay? And the HIV virus is obviously very different from a respiratory virus. HIV uses a barrier to stop spread. HIV contact tracing could work because you know who your sexual partners are. This is a respiratory virus that spreads by breathing. It's not the same thing, obviously. And by the way, the whole failure that Fauci presided over with HIV was his focus was getting a vaccine and disregarding treatments. And then the other point I'll make about what Fauci did when you look up is that he started talking to the press. After the transmission of HIV was known, the method of transmission, he was still saying in interviews and in the journals, but you better be careful, we're not sure, you could still get it from casual contact even with your children in your homes. And the AIDS activist community in San Francisco despises Fauci for his failures in AIDS. But those sort of failures where Birx was working in the same lab with Fauci, where Redfield and Birx were distributing money for AIDS, they were thinking partly that this was sort of their model, and the model is grossly wrong. I mean, there's a tremendous amount of incompetence. I understand that's not attractive and people want to talk about this sort of bigger picture, but there's a shocking level of incompetence, which means we need good people to come in.
That's always the easiest explanation, is that there's just a lot of incompetent
It's
people.
very true.
We had some big news this week. Yeah. Oh, sorry. Go ahead.
Can I just
Yeah.
what Scott was saying? One thing in terms of the incompetency, and this I think plays a big part, at least from my point of view, is the epidemiological modeling, because the models the epidemiologists use came out with the Imperial College of London, Ferguson's group, for example, came out with an estimate of a huge number of deaths would be incurred if we did not lock down. And of course, then the mechanism in London is the BBC is powerful. I can't remember how many, what their audience is, and I think 36 or 38 languages is something like 400 million. The Imperial College of London comes out with their estimate of the number of deaths. The BBC gets on it, and then you get the fear machine going big time. And literally, the day after the Imperial College of London study came out, the Parliament in London locked down. I mean, they click into the Imperial College of London studies right away. Now, what's wrong with the studies? The reason that they're so flawed, they assume there'll be no voluntary behavioral adjustments associated with whatever the pandemic happens to be. And if you look at, for example, the easiest way to think about it, look, people react to things. If you're in a kitchen someplace and somebody says, you know, that stove is hot as hell and don't touch the thing, and it's red, you tend not to touch it. I mean, that is a voluntary behavioral change that occurs. If you look at the Spanish flu in the United States in 1918, of course, the flu, it started primarily in New York City, and you had a lot of deaths, and then, of course, back then, the news got out, filtered out into Chicago, ultimately San Francisco. Well, the death rate was not nearly as high as you went out into the Midwest, and by the time you got to the West Coast, because people adjusted. They didn't want to get the flu. So
People know when there's something going around, they don't behave the same way.
So this is a big problem. The epidemiology crowd, who attacked, by the way, our study tremendously. You know, my colleagues at Hopkins, not all of them, but most of them. I mean, talk about being canceled, and I'm tenured too. So.
We had some big news this week. Yesterday, the CDC's Advisory Commission on Immunization Practices voted to put the COVID vaccines on the childhood immunization schedule. I think the cost benefit for this is non-existent. They have no data that supports this decision. I think it may be partially motivated by having continuing liability protection for the manufacturers, because the program they currently have liability protection under only applies during a national emergency. So if the emergency ends, they would lose that protection. Now they'll be covered by a different program. But I'm wondering, Dr. Atlas, what you think of this decision and whether we're going to see states use this as a basis for mandates.
Okay, well, I'm sure we will have states that will mandate the vaccine. I mean, that won't shock me at all. It'd be surprising if most states didn't. Now, here's the issue. This is a gross outlier in the civilized Western world to make a decision like that. Okay, and here's some facts. We have a virus where healthy children do not have a significant risk for death or severe disease. That's a fact. That's not an opinion. We have a disease, a vaccine that does not prevent transmission of the virus. So even if you believed in a horrendous, morally bankrupt position that we should be using our children as shields, which is completely, I mean, I'm a father, that's unacceptable to me. I'm a shield for my children, they're not a shield for me. But even if you believe that, it doesn't work. So that's not a reason to vaccinate children. We have a situation where most countries, there are ethical societies and there are unethical societies. Sweden, Finland, Denmark, Norway, not only doesn't recommend the vaccine for children, some of those countries forbid the vaccine for children unless they're high-risk children. We here, even the UK's Advisory Committee on Vaccine, said that back in 2021, the data shows that healthy teenagers should not be universally vaccinated. That's what the advisory panel to the NHS said. Whereas our people are mandating a vaccine. And by the way, the vaccine is under emergency use authorization. What does that mean? That means that the safety and efficacy were short-circuited because there's a public health emergency, quote unquote. Emergency use authorization, there are certain requirements according to the FDA on the definition of an EUA. And that requirement is that the disease must have severe or lethal consequences to the person who gets the disease. Okay, in this case, that's already, number one, that's not true for healthy children. It doesn't meet the requirement for EUA. Secondly, there's no public health emergency. Okay, that's just false that there's a public health emergency at this point in time. So why would you get an emergency use authorization? And lastly, the data determining the efficacy of this vaccine in children was based upon the antibody level response on a blood test. Okay, that's not a clinical trial. A clinical trial, by definition, has a clinical endpoint. Why didn't they use the clinical endpoints of severe disease or death? Because no one in the trial, even the placebo end, was hospitalized or had death. So they couldn't use that. Why didn't they use the efficacy against infection? Clinical symptomatic infection, because their data that they submitted to the FDA shows that after 60 to 71 days, after 2 months, the efficacy against symptomatic infection is 31 to 50%. No vaccine would be approved with that kind of data. So they didn't even use a clinical endpoint to approve this vaccine that has no significant benefit to the people we're mandating it for, children. That is an experimental vaccine with known and more data coming out all the time on known side effects. So this is a complete breakdown of medical ethics in the United States. Now, the other question I want to mention, or the topic, is the data on the side effects. You realize we have almost 1 billion doses now given of COVID vaccines, and we still don't have a complete handle on the side effects? I mean, you have to think, this is another why. Why is that we don't have data? We have a drug that's been given almost 1 billion times in the world, and we don't have a very thorough list of side effects. Yeah, I don't know why.
Do you think that the original vaccine saved lives?
I think the data is that the original vaccine saved lives in people who had a risk to die. If you look at the data, okay, now here's what I do. I look at data from other countries because I don't trust the United States and CDC data, which is a sad statement. You look at Qatar, Sweden, Israel. The data shows that people that are particularly under 80, but even over 80, have a relatively long-lasting protection against death compared to non-vaccinated people. Now, the question is really more refined, which is, what about the people who've had COVID? In the United States, 85% of people have had COVID. That's the CDC's estimate. COVID recovery has better protection against infection, against symptomatic infection, against hospitalization, and against death. COVID recovery has better protection than vaccinated, uninfected people, never infected people. That data is from Israel. It's shown, it's proven, it's not arguable, and it's not a surprise, by the way. That kind of concept's been around for 2,500 years. So that's the question is, even if the vaccine saves lives, what about the people who have had COVID? I gave a talk yesterday in Chicago at a senior center because my mother-in-law lives there and they asked me to. And they had these questions and it was sort of interesting. Even the high-risk people understood the sinful way we have treated our children, number one. Number two, they want to know, what is the benefit of a vaccine if you've already had COVID? According to the Israel data, there is no benefit. According to the data published by Israel, it's not an opinion, there is no benefit of protection of adding a vaccine to somebody who's had COVID.
So, Phil, do you agree with that?
I think that there was pretty clear evidence of benefit for the original vaccine with the original viral strain, and in particular, in the nursing homes, we saw this incredible sort of zeroing of very high death numbers to almost nothing, which cannot be explained other than with a highly effective vaccine. I think that the efficacy waned much more rapidly than we expected, and the virus also changed. And the other thing is the population changed because we had many, many more people who had already had the virus. And so the question, to me, it's two different questions. Was the vaccine valuable and useful when it came out? I would say definitely yes. Is it crucially important that people continue to redose over and over and over, even if they've already had COVID? I don't think so. I don't think that's well supported by the data. But I want to shift gears a little bit, Steve, and ask Casey why the United States had this huge increase in drug overdose deaths that other countries didn't seem to have, because that seems like one of the biggest downsides of our pandemic response.
Actually, Canada also experienced that. What we have in common is we had really astronomical benefits. Obama, I remember when President Obama made a bonus for unemployment, it was a really big deal. It was like, wow, that's a lot of money. $25 a week. That's what Obama did. Controversial. We did 600. And then later 300. And we also did it in these phases. So it came out and it's hitting the bank accounts in May, and then it got turned off August 1st, and then got turned on again in January, and then it got turned off again, differently in red states and blue states. The drug overdose deaths follows that same pattern. Remarkable, isn't it? Canada, they also had a very generous bonus, about that size, but they just had it on and kept it on. And their drug overdoses jump up and stay on. So it's maybe a remarkable coincidence, but certainly is any due diligence, if you're going to do something that's so far out of the range of historical experience, the $25 bonus, somebody ought to be monitoring, like, is there any unintended consequences of this? And there was no monitoring going on whatsoever. I was the first one to find this. But CMS, HHS, they should have been out there checking to see how's the health of our people doing, given that we've disrupted their lives. So even if we we made a mistake, we know now, right? But we could have caught the mistake earlier by being kind of Bayesian, by gathering the data and checking and being ready to change course when we realized we were wrong. But we haven't done that. And still, even today, if I hadn't have done this study, we still wouldn't know what happened to drug overdoses and or what happened to diabetes deaths and all these things. There's no curiosity about the consequences of these really draconian policies.
There's no recognition they were wrong either by the people who did this, which, that's one of the issues. It's not that they're looking for an explanation of why they were wrong. They don't say they were wrong.
So we got to wind this
I
down,
think-
but.
Yeah, Steve,
but,
Steve, let me follow up
Okay,
with
go ahead,
Scott and
quickly.
Casey on this last point. So the bottom line is that in the military, if you screw up and miss your target, there's something called a after-action report that has to be done. And they try to figure out, what the hell went wrong. And usually there's a court-martial that follows that. So that's really what I think Scott and Casey would suggest. We need an after-action report on this whole COVID thing.
So it's a great point. In fact, I wanted to make a point because I feel so strongly about it, something about that you talked about, Scott. I actually was involved in one of the first protests in March of 2020 against lockdowns. I just thought it was, I'm not a public health expert, I just thought it was a complete violation of people's basic rights as Americans. And, when you talked about lockdowns being unconstitutional in Sweden, I thought they weren't constitutional here in the United States, right? Don't we have basic rights? And so what was so interesting about being involved in some of those initial protests, some of them were arranged by FreedomWorks and a few other groups, the incredible indignation, the hatred of what we were doing, and we were peaceful. We weren't throwing rocks or anything like that. These were peaceful rallies, and I've never seen anything like it before. The vilification of these people marching for freedom, and people forget that 2 months later, every city in America was filled with protesters, 10 times as large as ours were, Scott, because of the George Floyd thing. And the media never made a single peep of protest, as if somehow if you're protesting against racism, somehow,
Actually, the public health lockdown people endorsed this.
Exactly.
They said
So-
it's worth it to stop racism.
the hypocrisy is just so towering here. And so the main reason this has been a great panel, thank you all, but the main reason I wanted to do this is because I'm terrified that we're going to do it again. I mean, if you read the New York Times, they don't think lockdowns were a mistake. A lot of the politicians, the teachers' unions still, it's one thing they've been wrong, but to still be wrong, even though all the evidence that you presented and, it's voluminous, shows that they were wrong, that scares me, that we're going to keep doing this. So I wanted to end this panel by asking you all, what is the single most important lesson we've learned from the last 2.5 years that we need all Americans to understand? And Phil, I'll start with you, and we'll just go right down the line.
I think the number one lesson is that the media cannot be trusted, and that our public health authorities do not tell the truth. They say what they think people need to hear to behave the way they want them to behave. And that's the explanation behind almost everything that went on and went wrong. And in particular, this lie that the hospitals were overflowing while we were at historic underutilization and people were dying of heart attack and stroke because they wrongly believed there was no spot for them at the hospital.
So Phil,
That should never
why
hap-
did they lie? I mean, is it
Because they thought that if people were, they thought that if people were scared and thought there was no room at the hospital, that they would behave more virtuously in terms of avoiding human contact and reduce the spread of a virus. And so it was always about say what people need to hear to behave the way we want them to behave rather than conveying truthful information. And I think the number one takeaway is you can't do that. Put the facts on the table and trust people to make decisions based on the facts. Don't try to distort your presentation of things to get the behaviors that you desire. And I think that we really, if we do have a Republican Congress next year, they've got to put some real time and effort and energy into doing sort of retrospective oversight and really piecing together how everything went wrong and making the case to the American people so that it doesn't happen again.
So Scott, before you go, I forgot was one other thing I wanted to mention. I call what happened with COVID mad cow disease because it was madness. And it wasn't, the thing that's almost most, makes me most fearful, back in February, March, and April, I'm not going to mention any names, but even major conservative and libertarian organizations came out in favor of lockdowns. I mean, when we came out against the bill, we were like lonely voices. Now a lot of those groups have kind of rewritten, oh, we weren't against lockdowns, but they were for lockdowns. And so I call it mad cow disease. What happened? Why did people lose their sensibility? And then you can also answer the question about what is the most important
Yeah.
lesson.
Well, I want to underscore that. I think the conservative policy institutes, the conservative organizations, the libertarian organizations, they're gross failures, okay? They were invisible during the lockdowns,
Yeah.
invisible during the
Right.
personal destruction of people who
Right.
stood up against the lockdowns. I think we need to rethink the efficacy of existing policy institutes, existing organizations that pretend to speak for freedom of speech on campus. I'm very skeptical. I think they've failed. To me, the most important thing, and there are so many, are this I would say to people. The era of trusting people on the basis of their titles and credentials alone is over. You must be a critical thinker. Here I'm talking to regular people, of which we all fit in to that group. We need to be able to look at information, to critically think about who's saying what and why, and then we make the right decisions for our family and our children. The era of sort of hiding behind things is over. It's true that we can't have public health agencies act unethically or dictate rules instead of advise. These things need to be changed. We can't elect people in government who say, oh, the CDC says this, therefore that's the policy. Okay, we've seen this over 2 administrations, by the way. That's not a political statement. This is uniform in government. They're weak people. We need to have real leaders occupy leadership positions. But in terms of what an individual can do, they need to be a critical thinker for themselves. They're an adult. They have to take information. There's a bigger burden on you now because the trust has been lost, but the trust is appropriately lost in these people.
So who do we know who to believe?
Well, I think this is what you have to, you're supposed to be a thinking individual. Okay, you look at somebody who does a lot of hand wringing and says, oh, we don't know the risk situation, we don't know this, we don't know that. And then you look at somebody else who speaks about the facts, who cites the data. Okay, you ought to be able to distinguish between these kinds of people. You must. You cannot say to somebody, oh, this guy's the head of the National Institute of Infectious Disease, therefore he's the right guy. This is the local county health official. This is the governor. This is the president. No, you have to look and assess it for yourself. And it's harder. There's a challenge here. It's not easy. There are specific things that I and others have outlined, including adding transparency to the way decision-making, bringing in more outside people to work. You can't have people who are bureaucrats doing these complicated policies and pretending that they're scientists and critical thinkers. The problem is when you cancel people out who step forward from the private sector to help, it makes it harder to get good people to step up. This is the self-cancellation is a big problem in the United States now. I had hundreds of emails from all over the country saying, keep speaking, you're right, we are afraid to speak up for our families. Okay, that's very dangerous. So we need to be a little more aggressive about our own critical thinking. It's a sort of a simplistic message, but I really think that's true. You don't trust people just because of who they are. You have to make a much better, a more critical assessment of them.
So before I get to Casey, and you may want to dodge this question, but you were there. You were on the ground floor in the White House. How much of you do you think this was due to the fact that Donald Trump was in the White House and that the left hated Donald Trump? And so everything he said they wanted to say the opposite of. And you could see that even in the, Trump was wrong about certain things for sure. But it almost seemed like if Trump said something, the media and the left would say he's completely wrong about this. And
Well, I think that's absolutely part of what happened, particularly early on. In fact, the first day that I went into the White House and was talking to the president, I said to him, he started asking about hydroxychloroquine. This is back, and I said, well, the first thing you should have done was say hydroxychloroquine does not work. Because that would have inspired a whole effort to try to prove that hydroxychloroquine worked. So, I mean, that was definitely true, but I think it wasn't just that. Of course, it became something more deeper than that because it continued during the Biden administration. But also there was a political, I wrote this in my book, there's a political sensitivity that was sort of, to me, really despicable. But all politicians have it. That I was told many times, stop talking, you're rocking the boat, there's an election coming up. By the way, the president never said that to me. He never said stop talking. He did the opposite. But the other people that were the intimate advisors, they said stop talking, you're rocking the boat. And I said, I'm sorry, the effing boat is capsized and people are dying, and I'm not going to stop talking.
thank you for what you did.
There was Steve, if I could, there was a particularly fateful 10-day period at the end of June, beginning of July 2020, where it looked like we were on track for a normal school year that fall because the American Academy of Pediatrics had broken with the CDC, and they came out with very reasonable guidance that basically said all schools should be open. If you can't do 6 feet, do less than 6 feet. They need to be there in the classroom, not at home. They said elementary school kids are not going to wear masks all day, so don't worry about masks in the lower grades. And it was a very reasonable document. A couple of days after it came out, they spoke at the White House in a room with Donald Trump saying, the president is right when he says we should have schools open. And then about a week after that, they 180-degree reversed in a literal joint statement with the teachers' unions, and they said actually the school should be closed. And I don't know how you can explain that other than they saw the president was going to get credit for it and they reversed. And I think that, the enormous harms that happened over the next year can really be traced to that week.
Although the teachers kept protesting about working even beyond the Trump administration, including refusing to work online.
Okay, Casey.
Now, Phil, were the schools closed in Canada?
Yeah, they had pretty lengthy school closures. It varied by province and so
I
forth.
think a lot of this nuttiness happened there, and they did not have a populist leader.
Yeah.
They had quite the opposite.
So what was the biggest mistake?
So I think, I can answer both your questions, Steve, with really the same idea. I think central planning is seductive. Put a string on your finger to remind yourself, we always overestimate what the central planning is going to do. And it's the flip side of what Scott said, that the other side of the coin is freedom. We underestimate freedom and what people can do for themselves because they have the information, they have the incentive, and let people prosper. I think that's the lesson. And as a teacher, COVID's been great for me because gave me a very vivid way to teach that lesson. A lot of these ideas that seem more abstract, or we're talking about China or the Soviet Union somewhere far away, is like, no, it's right there, you were there, and you can see how badly central planning failed.
Scott, what was the lesson of Operation Warp Speed?
Oh,
I'm
Operation.
sorry, I actually meant, well, you guys, I'd like you both to answer that.
Okay,
'cause
yeah. No, Operation Warp Speed was successful in having somebody in charge, President Trump, who understood how to do logistics, who do things simultaneously. The Operation Warp Speed was not just red tape cutting, it was actually getting everything organized so that when the vaccine was approved, it would be rolled out instantly. And I think that was very good at using private sector sort of business common sense to get things done, as opposed to the typical way things are done. And there was a failure of Operation Warp Speed, many failures, but one was in the lack of getting the drugs studied and developed quickly. They did develop drugs quickly, but they didn't start focusing on drugs that were already FDA approved. And you have to wonder why, whether that's a pharmaceutical corruption sort of reward incentive or not. So I think that the idea that Operation Warp Speed was somebody who applied private sector business principles to make things more efficient. I think that's very positive.
Is this a deregulation success story?
I think
Casey?
okay.
Scott, I think you came at the end. Actually, I worked in Trump White House about a year or two before Scott was there, and we were approached, the econ team, by the national security people saying, you know what, we're worried that a virus might come either from our enemies as a weapon or from an animal. We're not sure which. And we want to be able to think through the economics of that. And what we concluded was we need innovation. Innovation in treatments, innovation in vaccines. We can't tolerate the standard FDA delay. The trade-off between safety and speed is different during a pandemic. We all worked this out, okay? We had an executive order in September 2019, that was before you got there, that said what I just said, okay? Fauci, this is the first time Fauci met the president. He put on his doctor's, because of course we're working with the Fauci people to do this. He puts on his doctor's suit to come to meet President Trump, first time ever, while the executive order signed. Fauci knew that this was our plan, to let the private sector mass produce, quick approval process. He knew that. But what do you see him doing in March and April now when you're there? He's pulling the president aside in public and chastising him for saying that the vaccine would come by the end of the year. And not only was he wrong on the facts, we know it came by the end of the year, but he was wrong in terms of our internal process. We had already worked out that that's exactly what was going to happen. And President Trump had already had experience with the FDA on more mundane things like generics on how to get the FDA ship to turn more quickly. So he had all that experience to bring to bear once we had a thing called warp speed.
Yeah, absolutely. In October, if I can mention this, at one of the internal meetings, I was reading the actual contractual obligations of logistical deliveries. I wasn't winging it and making it up at the press conferences. And Birx turned to me in front of everybody and said, you can't say we're going to have that number's wrong. We're not going to have those vaccine doses ready. You can't announce that, even though that was, and the question is why? You know, why was she saying that's not possible? It is possible. It was the numbers. And I turned to Paul Mango, who was the advisor to Azar. He was sitting, I said, Paul, am I right or wrong here? He said, no, you're exactly right. This was the contract. I was just reading the numbers. There was a specific, explicit attempt to stop good, positive news from being disseminated to the American public during the month of October, which has a certain time significance during 2020.
Yeah, to wind up, I'm reminded of my rule that I always start every class with, and I'll end this session with, and that is my 95% rule. 95% of whatever you read in the financial press, I always tell my students, is either wrong or irrelevant. Well, I think in this public health sphere, the percentage is really quite a bit above the 95%. We're probably in the 99 point something or other. But this gets back to what Phil was saying, what Scott was saying, what Casey is saying. I mean, we really have a major problem with the media. And I know in our study, for example, that here's how it works. We did our study, a professor from Johns Hopkins mentioned it on, of all programs, Tucker Carlson, and the fact checkers went wild. There's something called fact checking, which is horse shit of the highest order, and one came out. We produced like a 100-page working paper, and the fact checkers lit on it within 24 hours. There was a press release by Ferguson and his colleagues at the Imperial College of London because they were afraid of our study,
Right.
and you had 3 doctors from London that were hyper negative, every negative thing, and one on that press release that was very positive. The positive comments were canceled. The fact checkers never included anything like that. And then you had all kinds of irrelevant things like the paper wasn't peer reviewed. Well, working papers are not peer reviewed, for Christ's sake. And another big criticism of the study was it wasn't endorsed by the Johns Hopkins University. Well, it was published by my Johns Hopkins Institute, but Johns Hopkins University or the University of Chicago or Stanford The universities do not endorse research done by professors at universities. So all of this stuff filtered into the press because the press are so ignorant, they have no idea how research is done, how universities are run, what even a peer-reviewed message is or article. It just, it gets all, the spin cycle, you know, they bought the biggest washing machines you could possibly imagine, and they were spinning. And that's what happened, by the way, to our study. It never entered any of the major press, the Washington Post, the New York Times, the Wall Street Journal did pick it up as a daily thing just because it was hot on social media. So it was reported on their social media coverage. So
Wait, was the Imperial study, whatever you call that, was that ever peer-reviewed, or?
no, no, it wasn't peer-reviewed. Now that you mention it, I hadn't even thought about that before. But by the way, the Imperial College of London and this Ferguson group, they have, you mentioned foot and mouth and a variety of other pandemics. Their epidemiological modeling has set off all kinds of nefarious public policy reactions almost immediately. And all their epidemiological studies have been so far off the mark, ex post facto, you can't believe. But that's how the system works.
Yeah, well, we've got a lot of work to do. First of all, thank you to Phil and Scott and Casey and Steve. Fantastic job. We learned a lot. Thank you all for being here. It's been an amazing, amazing 2 panels. I hope you all learned a lot. Thank you to C-SPAN for covering this. And I hope we don't get censored. You know, I mean, this was pretty hot stuff. Everybody have a great weekend, and we will see you all soon.